I want to keep up my running. It's enjoyable. It's therapy for me, both mental and physical therapy. I always wanted to run the Tunnel of Towers. I think it's a patriotic event. My father was a policeman in New York City, so I'm running really for all those that lost their lives on 9/11.
I first met Mr. Murphy 2 years ago when he was diagnosed with pancreatic cancer. He had just gotten out of the hospital and came to me to discuss neoadjuvant chemotherapy. And so we went through a very intensive 3-month course of chemotherapy. We were able to take him for surgery, and then after surgery, the pathology showed that his cancer was in the lymph nodes, and so we gave an additional 3 months of very intense chemotherapy. 1 year after therapy, he's disease-free.
The most difficult part about being diagnosed with cancer is that your life has to change. And the treatment options we have right now, they're very hard on the body. So if you're used to live a very active lifestyle, that is gonna, unfortunately, be a little bit taken aback. So the goal is to be able to bring them back to the lifestyle they had before, because the most important thing in the cancer survivorship is to maintain your desire to live, never to give up hope and do whatever you were doing before this storm hit you.
Should we go find the truck for the bath?
I thought the best I'd ever be able to do, if I was lucky, was to walk again. I was still on chemotherapy. As they told me, you need to get out of bed, you need to start walking. I was tied to the bed with tube feedings and what have you. But I decided, well, let me go do some walking, and then walking led to a little jogging. I started becoming a very productive runner. I could run to the stores, I could run for my medicine. Any opportunity I could to get back to running, I did.
You know, you could tell that Mr. Murphy was a big runner. He had run 15 half marathons, 3 marathons, and running was a big part of his life. And I'm also a runner. I know that running becomes part of who you are. And when you can't do that any longer, it's taken away from you. You lose a sense of who you are. So I was determined to get him back running. And I promised him that once we were done with his treatment, we would run a race together. So we're here to celebrate his accomplishments and perseverance and his strength. And I'm so thankful to be able to run by his side.
I always said I'm not really that strong emotionally and physically, but they kept on telling me, yes, you are. You are strong and you can do it. Stony Brook's excellent. They were very supportive when I did not feel like I was going to make it. I didn't feel like I was going to improve. They were always there supporting what I could do. I'd like to thank the Stephen Siller Foundation and the Wounded Warriors Foundation, and also the Stony Brook Hospital. I also want to thank my fellow runners, Dr. Georgakis and Dr. Gemmill, for making that pledge. I had a smile on my face. I didn't have many smiles on my face dealing with the pancreatic cancer, but I was very pleased that they offered and came through with wanting to run with me. So I'm thankful for that. I can get back on my feet now. These guys are great.